Alrighty. So we still may have a few more people come in, but just for the sake of time, we are going to go ahead and get started with our office hours. We're super excited this month. We are going over digital call reflection. And so just to welcome you all, I want to introduce myself. My name is Hensley, and I'm a customer success associate here at Luma Health. I've been here since almost 2 years now, but I've been in the customer success associate role for a little over 4 months now. And today I have my lovely colleagues, Kat, who is the senior product manager, and Jennifer, who is the head of product design. And they will be going over all of the details and anything you need to know about digital call reflection. Just as every other office hours, this will be recorded and sent out once it's done. But in the meantime, I will go ahead and hand it over to them, and feel free to ask any questions in the chat, and we'll start from there. Cool.
Awesome. Thank you, Hensley. And hi, everyone. It's nice to see some of you again and meet some of you for the first time. As Hensley said, I'm Jennifer. I lead our product and design teams here at Luma. And so today we're going to be talking about all things digital call deflection. Next slide, please. What I'd like to do is to set the stage for even why we're talking about digital call deflection. And then I'll hand it over to our main speaker, who is Kat Midlider, as Hensley said, and she is leading the effort on all things DCD. So next slide, please. Let's talk about the state of healthcare economics. It's a daily conversation topic and something that's, I'm sure, definitely not news to you, especially as most of us are perusing the front page of Becker's and constantly seeing headlines about closures, record losses, all pointing to inflation, high labor costs, decreasing margins. It's the reality of today. Next slide, please. And you feel this every day, right? Like you are also recovering from the pandemic, that staffing shortage continues. The cost of supplies and medications because of supply chain, that's continuing, and the COVID relief funds, that was last year's news, and the year before. Like it's a tough time, and that's definitely just one side of things that we're hearing from a lot of you. Next slide, please. And the second thing that we're hearing is that you're having to do more with less. There's constant pressure to keep up with the demand of patients that are coming in. We're seeing that volumes aren't quite as high as they were as pre-pandemic. Maybe they are for some of you, but they're definitely rising. And with the staffing shortage, the high costs, it feels more challenging than ever to run a healthy business, which leads me to our focuses for 2023. Next slide, please. So the sorts of messages that you've heard from us before have been really around growth and expansion, and that was really in the context of a healthy economy. But, that's not where we're at today. And so, our focuses for 2023 and beyond, but especially for 2023, are to deliver products to help you to drastically reduce those costs, drive up that time efficiency, and on top of it, create great staff and patient experiences. We know that's what you're focused on, and therefore that's what we're focused on. And so one of the things that's going to drive all three of those goals is digital call deflection. So with that, let me hand it off to Kat, who's going to talk all things DCD. Kat, over to you.
Thank you. All right. So I think some of you probably heard me talk about this before, but if you haven't, to sort of reiterate what Jennifer said, we're in a place where there's lots of need and there's not a lot of resourcing. We've got surveys showing that healthcare consumers hang up after about a minute on hold, and of those 60% that hang up, only 32% actually call back. So the loss there of the patients just completely is huge. 84% of patients indicate that wait times are important, and 20% of those folks will actually change providers due to long wait times, which I think is really big when you think about sort of the state of the world. And folks that I've talked to, our customers and even my providers, sometimes the hold times are 15 minutes, 30 minutes. We're talking a lot longer than a minute. And that just compounds itself over and over and over again. Next slide, please. So what that does is it just creates this vicious cycle. So for patients, we've got long wait times, they're getting frustrated, and in some instances, they're disengaging altogether. For staff, the ones who are answering the phone, they're dealing with the patients who have just sat on hold for who knows how long, and they are busy and they are dealing with frustrated patients. So there's burnout and there's low morale. When they do finally get someone on the phone, they're angry, and they take it out on the poor staff person who's picking up the phone. All of that then turns into problems for the organization, which results in high turnover, patient leakage due to those folks who just decide not to call back, and then also obviously poor patient experience. That has the, can you go back please, Hensley? Thanks. So when we think about what that sort of bubbles into, there's huge opportunity costs associated with turnover. We're talking not just the fact that you have to go hire someone new, but you have to train someone new. You have to pay overtime costs probably while you're trying to like make up for the loss of someone who is left due to burnout or low morale. So we just keep building and building and building and creating this really unfortunate cycle for both our own organization and for our patients and providers. There's this, admittedly, I'm not good at math, but I'm a very visual person. And so I had this example come in where it was really simple put for me, which was if a call center receives 2,000 calls a day and 1% of those are abandoned due to lost calls, that's 20 lost calls. And if the customer lifetime value is $100, that 1% abandon rate results in $60,000 in lost revenue per month. It's like mic drop and walk away. It's huge. So that's why we have created this digital call deflection product, which I'm really excited to speak to you about. We can move on to the poll. So there's a poll that's going to pop up, which is going to ask you what your highest call volume reason is. If you don't know what it is, that's fine. But we tend to see a pattern for call volume reasons. And a lot of them are realistically things that can be taken care of through products you actually already have with Luma online. Or that really just don't need a human interaction, but it's a behavior. Folks are really used to just picking up the phone. So let's give some time for that.
Cool, yeah, we'll give it about 10 more seconds.
Great.
All right, awesome.
Cool. So what we're seeing is not surprising. So 50% of you said prescription refill requests. Coming in second is scheduling, and coming in third is billing. Not at all surprising. That is definitely what we see. If you can move on to the next slide, please, Hensley.
Yes.
Thank you. So this is why we created Digital Call Deflection. So Digital Call Deflection is the ability to route calls that are calling for things like, for example, scheduling or prescription refill requests. It's like you guys already saw in my slides. So moving those calls to text instead, and not to text messages where it's a one-on-one conversation, but moving those to your online tools that you have. So with IVR interception, we are sort of branching into your call system, and we're offering patients the option to not wait on hold. So if they are on the call and listening to the IVR menu, push 1 for scheduling. Then they hear we've got an option to move this call to online scheduling. If you'd like that, dial 1. Otherwise, dial 2 to speak to our next patient service representative. So that's sort of just high level how we're working with DCD. So for scheduling, here's a great example. So we are looking at this option of like when patients just really, they don't want to wait on hold, or they can't. They've got, their 10 minutes while they're free right now to make that phone call, and your hold time happens to be 15. But we don't want to lose them. We don't want that drop off to happen of not calling back or forgetting to schedule the appointment period. So we have this great option with DCD where we can send them your scheduling link and sort of keep that task going for them. So they picked up the phone once to call and make an appointment, and now we can keep that going for them, which is really great. So we can route them to schedule a new appointment. We can help them reschedule or cancel an appointment. And we can also do where they can view their upcoming appointments. One thing I hear from customers frequently is that a customer is calling in because they just don't remember when their next appointment is. Or a customer told me recently that they had someone wait on hold for 20 minutes just to cancel an appointment that was like 2 months from now. Those just aren't necessary, and those phone calls are clogging up the line. And if those calls weren't there, the call center staff or whoever it is picking up your phones could spend more value-added time elsewhere. So a couple more use cases. Next slide, please. Prescription refill requests. Again, it's like you guys saw in my slides. So with here, we have LumaBot, which is our chat bot that is a HIPAA secure chat bot that's on your website. And we can send a link to your patient's cell phone and then launch them into a prescription refill request flow that then they can just do that all on their phone, and they don't have to talk to anyone. So we free up the lines, we free up the messaging, no voicemails, none of that. It just goes right into Luma. So it's really great for both your organization and from patient experience. I know, like, for instance, for me, I always remember to do something when I'm laying in bed. That's when I remember to do it, right before I go to sleep. And if I can do it then, I will. And what the hope is, honestly, is that for folks who are in the habit of picking up the phone, we can sort of shift their behavior over time to recognize that as they call in and they're continued to offer these messages that they can move to their cell phone, they will. We know that a lot of patients don't go to your website. That's not how they do things. So this is kind of like that interjection between picking up the phone and having to go to your website, of pointing them to that product you have. And so these two examples were using Luma associated products, but we can also do other things. Like we can, for example, link to a Google Map link. If people call in asking for your address or for directions, we can text them a Google Map link so that they can get directions when they're on the road, for example. So next slide, how it works. This is sort of what I talked to earlier, but just to give you a visual, because I'm also a very visual person. What we do is we just add a new branch. So we partner with you, and you've got your own phone tree. And what you do is you create for, in this example, a second option where the patient dials 2, and that pressing of 2 calls us. And what we then do is we offer them the options that we've built, which is a myriad of things. In this specific one, we've got scheduling, LumaBot, or Google Maps. And one thing that I don't have represented on here is that we can also handle landline phone calls. So if someone is calling in on a landline, but they do have an SMS enabled device, we can walk them through that. So that that first greeting there can say, if you're calling from a cell phone, press 1. If you're calling from a landline, but do have an SMS enabled device, press 2. And then in the landline workflow, we'll get that mobile number from them and then continue on this flow for them. So it's pretty slick if you were to ask me, my opinion. So there you go. That's DCD. I know that that was quick, but that's it. And I'm excited to now do Q&A.
Cool. I think we've
Oh,
got
there's one more
a
poll.
poll, and then we can do some questions.
We've got a lot of other call systems. I'm curious as to what the other ones are.
Yeah, folks who are responding with other, would you mind dropping in the chat, like what your phone system is? We'd love to hear it.
I almost put 3CX in the option and I didn't.
Cool. I think we will give it one more second, and then in this, looks like we have a few Ring Central and then others. All right. So next, we will let Kat or Jennifer take away for when is this coming?
So we are in early access right now, and that's a program that we are where we're sort of getting the kinks out, or we've got some customers signed up for it, and building that out. And then we hope to have the product launch for everyone mid to late Q2.
All right, so I think we already have a few questions in the chat, so I'll read those out. But if you have any other questions, feel free to ask them now. But we'll go ahead and get started. Let's see here. I think the first question was, when calls come in and we're busy, can the customer press say 1 and then they get a text from Luma? Can they continue their request via text?
Yes. I guess it depends on what the request is. If it's a request that we have worked, that we've built into the DCD flow, then yes.
Okay. And does this product convert voicemail to text in the patient message?
It does not convert voicemails, no.
Is there an extra charge for this product for existing users?
Yes, there will be.
Will LumaPay and Waitlist be integrated later?
That's a huge hope of mine. Yes, we do know that, especially from the billing point of view, it would be very handy.
Any other questions in the? There's no more questions in the chat. Does anybody else have any other questions for Kat or Jennifer? Good. All right. Well, I think that is it. Again, I appreciate Kat, Jennifer, thanks so much for hopping on and giving us this overview of digital call reflection. As I mentioned at the beginning, this was recorded, so we will send you the recording of today's office hours if you want to share it with some of your team members. And then from there, if you have any further questions, feel free to reach out to your customer success manager here at Luma. They'll be able to help guide you, answer any questions you have regarding digital call reflection. And so for the meantime, next office hours will be April 20th on a Thursday, and we will be discussing FQHC tips. I'm going to check the chat one more time, just make sure. This is good feedback we would like to hear. Yes, this is going to revolutionize the way patients contact us. That's awesome. But yes, thank you all so much for taking the time and joining us. And if any other questions come to mind as you're watching this back, or any of your other team members have questions, like I said, feel free to reach out to your customer success manager or your account executive. And we will just continue from there. And this recording will be sent out shortly. Thanks so much again, Kat and
Thank you.
Jennifer. And thanks everybody for joining.
Thanks all.